Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about the national opioid crisis, about its impact here locally in St. Tammany Parish, and how St. Tammany Health System is taking a system-wide approach to reducing the use of opioids and increasing the use of other ways to reduce and manage pain. We talked with Dr. Mike Hill about the crisis itself and about the strategy for reducing opioid use. And then we talked with Jay Morange about how physical therapy can make a difference. And we talked about emergency departments and outpatient settings. Last, we'll be talking with Bert Lindsey, who will look at the hospital situation and how physical rehabilitation makes a difference in patients' lives. Bert, thanks for joining us.
Thank you for having me.
We are really glad to have you here and looking at this situation. You know, you've been involved in rehabilitation, physical therapy for a very long time, and you can talk about a history of before opioids and then the difference that happened and where we've sort of come back to a system of physical therapy that went away for a good 20 years.
I actually was a coordinator at a hospital in '95 when a nurse administrator came to me. And she was gleefully happy that she could tell me that we were going to be able to get rid of all of our modalities that we, at the time in '95, still did for patients. They didn't have the technology that we do now, but we were doing them regularly. And she said we have 2 new medicines coming out in '95, '96, and that was Percocet and OxyContin. And within 6 months of that getting here, we were out of the pain business. And
because it was just going to, okay, if you're in pain, we're going to prescribe a medication.
And that's exactly what they did, and it worked. And we were out of the pain business, and to the point where they didn't really even teach it in school.
Wow. So physical therapy programs, training physical therapists were really not as focused on pain.
Well, we were in the mobility and pain business, and then we were just in the mobility business. That's it.
Very good. And then as this national crisis, as Dr. Hill and I were talking about the fact, like in a national recession and a national epidemic, you don't know you're in it until suddenly you really are. And then you've got to begin to find your way out of it. And the opioid crisis, the way out of it is to reduce the use and to find the appropriate use. And physical therapy plays an important role in that.
It does. Before that, though, you have to know you have a problem. And even before it became national knowledge, St. Tammany Health System was very integral in attacking the problem because we were seeing the fruits of that in the emergency department, where people would come back many times and just go from hospital to hospital to try to get their needs met. And I just rehashed something that I had seen in the '90s that really worked. And you know, I've been in this almost 30 years, so I just brought up the bright idea that we could consider bringing this back as just an option, an alternative. And they were all over trying it.
So what you're talking about is kind of giving the patient an understanding of what's happening and some accountability, and then introducing other options than a prescription.
Absolutely. And then the focus became to try to do as much as we can to reduce exposure. That is paramount to everything. And it's so paramount that we're still trying to convince CMS, Medicare services providers, that that's where we need to be looking. Because right now they're dumping a lot of money into treatment, which will always be there. But if you can stop exposure, you stop any future issues with dependence.
Right. So certainly everyone who already has an experience with opioid pain relief may be seeking more opioid pain relief.
Right.
And so your approach there is to help them reduce that need and find other solutions.
Right.
But then you're saying if we can reach a population that's never actually experienced opioid pain relief, and we can give them other ways for pain relief, then they maybe never need an opioid to begin with, or if they do, it will be for very acute situations and very short-term use.
Absolutely. And so instead of even addressing pain as acute and chronic now, we look at things as opioid naive versus opioid tolerant. The FDA has set that as a goal. So we're training not only the physicians, nurses, therapists, ancillary staff to address it that way, but we're also trying to promote that nationally. Because if you address it by the amount of opioids you're exposed to, you can better control that parameter.
Okay. And we've talked a little bit about the fact that opioid pain relief was in use outpatient, inpatient, emergency, it was everywhere. And our health system is looking at all of those areas for ways to reduce pain. So certainly as someone is coming into the emergency department, we're no longer prescribing that 30, 60, 90 days worth of pain medication. Maybe it's a few days, or maybe it's not an opiate at all, right, but other options. And if they have to be hospitalized, in the past we might have started that conversation with the patient about reducing their pain or eliminating their pain while they're in inpatient setting in the hospital. But we're actually adjusting that and introducing more therapy there as well. Is that right?
Absolutely. Anything we can do to limit exposure and make a person comfortable. One of the things that we started when we got involved in the initial National Joint Bundle efforts for total joints is we tried to establish through an individual one-on-one interaction with the potential patient that what is the pain level that you can tolerate during the stay. So we would have patients who would have total knee replacements thinking they should have zero pain out of surgery, and that's not realistic.
Right.
As soon as you get a realistic understanding and an agreement, a verbal contract, if you will, that we're going to keep your pain at this level, it makes things much easier. Pain is a byproduct of surgery in many, many cases, and to expect to have zero pain is not realistic. So as soon as we know what those levels are, then we can do whatever modalities from the least invasive to dry needling if needed, because that is invasive, to try to keep that pain within that agreed upon parameter that you want to maintain while you're in the hospital.
So interesting that from emergency, inpatient, and outpatient, one of the first things we have to do is work with the patient to have some understanding of what's actually realistic.
Some agreement.
So maybe, right, maybe we have had decades of medical practice that were creating an unrealistic expectation.
Yeah, and that expectation actually was reinforced by CMS when they made pain the fifth vital sign. These things all kind of fell in line. The OxyContin's coming about, the pain as the fifth vital sign, and then everyone having to address that. So it made it, in fact, pain as an HCAP score is no longer tabulated by the federal government because no one's able to achieve the structure that it sets up. People's pain is a subjective issue that we're trying to address objectively through the use of modalities and or pain medicines when needed.
Right. And so if a patient understands that post-surgery pain is normal and there is a discussion and an agreement between the caregivers and the patient about what that goal is to get well and get out of the hospital and what that pain threshold is to push to get there, right, then we have a successful experience of a surgery, post-surgery, rehab, and home.
Yeah, and you have an experience where the patient's desires and needs have been met by the clinicians, and that there is the buy-in, and you have to have the buy-in. You can't have a quality experience as a patient unless we're listening to what your needs are and giving you as best as we can realistically a pain measurement that we can help you achieve during your stay.
Very good. Well, I appreciate you coming in today to talk with us about opioids and about how physical therapy can make a difference.
Thank you very much for having us.
All right. Thank you for joining us on Healthy Living. We've been talking today about the national crisis in opioid use, how it's affecting people who live in St. Tammany Parish, and what St. Tammany Health System is doing to make a difference for patients who live here close to home.